Hi, this is Dr. Matt Lawless bringing you another knee moment from Knee Fit and 5 and MSM products. I get asked so frequently about stem cell injections that although I already did a video on injections, I was going to expound a little bit on that and just talk about stem cell injections because people are always very hopeful and that have their hopes on the stem cells and being able to reverse arthritis. So what the purpose of a stem cell injection would be initially to help with knee pain, but even at a more deeper level, people would like to have an injection or something to help reverse arthritis. So far, we don't have anything that reverses arthritis. So when you have a knee with arthritis, like in this example here, where the cartilage is gone, the cartilage has no way of healing itself. The hope would be that you could inject something into the knee, such as stem cells, and that would make the cartilage grow over top of here. Stem cells are very immature cells that haven't really formed into cells yet. So they are thought as you inject these stem cells, which are very young immature cells with the potential of becoming any type of cell, and they could become a cartilage cell and grow over top of this and heal it. So there's been some studies done recently. There was a study in the Journal of Cartilage from 2020 in August. There was another one in April of 2020. There was one in the Archives Orthopedic Trauma Surgery done in July of 2019. There was one in the American Journal of Sports Medicine in 2020. So there's two ways of getting stem cells. The first is getting it from bone marrow, and in the middle of your bone here, there is bone marrow. So if you can put a needle in bone marrow, usually it's done at your hip, at your iliac crest, you can pull this bone marrow out, process it, and inject it into the knee. The other form of stem cells is getting it from fat, where you aspirate or take out some fat, and then you process it and then inject it as stem cells. When you compare those two kinds of stem cells, the stem cells seem to do a little bit better with fat. So if you do the fat ones, they seem to do a little bit better than the bone marrow derived ones. Now this is complicated because not all of them show that, but most of them show there's a little trend towards the fat aspiration mesenchymal stem cells. So the stem cells are called mesenchymal stem cells. That's an early immature line of cells called a mesenchymal cell because it can develop into anything, simply called stem cells though. So the fat-derived may be a little bit better than the bone marrow-derived, but the bone marrow-derived are much easier to do. So most clinicians are doing the bone marrow-derived one, where they're putting a needle in your iliac crest, aspirating bone marrow, and then using that as their stem cell injection. So to go back a little bit, do those help at all? So both stem cells from fat and from bone marrow do seem to help subjectively. Meaning that if you look at various scoring systems before and after the injections, the people that get bone marrow do seem to get some pain relief. Or fat cell either. Anyone that gets stem cells does seem to get pain relief in their knee from the pain of arthritis. Now if you follow those patients on X-ray, MRI, or anything like that, unfortunately they do not seem to get any healing of the cartilage. So what you're essentially getting is an injection into your knee which offers some pain relief but does not reverse or slow down the arthritis. Obviously more studies need to be done to show if that is true or not, if maybe it's slowed down a bit, but currently it looks like it does not reverse arthritis. So the hope of getting this cartilage lesion to heal does not happen with stem cells. That being said, the stem cells do seem to help subjectively. So if you compare the stem cells to other types of injections, like a saline injection, which would just be a control injection, they do seem to offer good term pain relief, at least 6 to 12 months. Some studies have gone out 24 months, and some studies show that at 24 months, the stem cells do seem to be offering some pain relief. So long story short is that the stem cells will probably offer some relief from your knee symptoms, but won't reverse your arthritis. So if you're looking for pain relief, then they would be reasonable to consider But that being said, they're also very expensive. They usually cost several $1,000s. Insurance companies don't cover it. So what you're looking for several $1,000s is you should anticipate getting some pain relief, but not having any reversal of your arthritis. Now that pain relief, most of the studies are done with people with mild to moderate arthritis. People with severe arthritis, it does not seem to help as much as it does in people with a mild to moderate arthritis. What I mean by that is if you already have severe arthritis, the improvement in your pain is probably going to be much more limited than if you have somebody with mild to moderate arthritis and you have the stem cell injection. I hope that helps.